Thyroid storm. Thyroid storm is a life-threatening condition that comes along when you have uncontrolled hyperthyroidism. How does thyroid storm happen? So if a patient has uncontrolled hyperthyroidism and is placed in a situation where they have a new stressor to the body, it could be an infection, it could be stress, or it could be manipulation of thyroid gland during a surgery. So in those situations, the body goes and gets excessive amount of thyroid hormones and goes into thyroid storm. Coming to the signs and symptoms of thyroid storm: elevated temperature or fever, tachycardia, systolic hypertension, nausea, vomiting, diarrhea, which is GI related symptoms. Neuro-related, you have agitation, irritability, confusion, and if condition worsens, seizures, delirium, coma. These are the signs and symptoms associated with thyroid storm. How can we manage thyroid storm? First and foremost, airway. Make sure that the airway is patent. Monitor vital signs frequently. Administer again anti-thyroid medications. So methimazole and propofol thiouracil are medications that help to manage thyroid storm. Propranolol for hypertension. And you can also administer glucocorticoid. These are the medications that you administer to prevent or treat thyroid storm. In addition, antipyretics can be administered for making sure that the temperatures are within control, and also patient can be given a cooling blanket. Thyroidectomy. Thyroidectomy is a surgery that is done to remove your thyroid. You can either have complete thyroidectomy or subtotal thyroidectomy. As nurses, what are our responsibilities with relation to thyroidectomy? See, pre-operatively. First and foremost, make sure that there is an informed consent available. Secondly, monitoring. What all are we monitoring? We're going to monitor the vital signs. In addition, you're going to monitor electrolyte levels, because post-operatively you need to have a comparison between your pre-op and your post-op electrolytes levels. You need to have a comparison between your pre and post-op glucose levels. So therefore, you're going to check blood sugar levels. In addition, educate the person with regards to breathing and coughing exercises, because thyroid is going to be very close to your airway, and one of the potential complications post-operatively is respiratory or airway related. So it's very important that they know how to breathe and what all exercises they can use in order to prevent any complications which are associated with respiratory system. In addition, in order to prevent thyroid storm, you have to administer anti-thyroid medication, propranolol and glucocorticoid. When we are coming to the post-op care, it is very, very important to maintain the patency of your airway, which is why post-op thyroidectomy, you should have a tracheostomy set, suction and oxygen available at bedside. Monitor for any airway obstruction. Make sure that there is no respiratory distress. Check for any signs and symptoms related to laryngeal nerve damage, which includes high-pitched voice, stridor, and dysphonia. Avoid neck flexion. Make sure that your neck is positioned in such a way that it's not flexed and obstructive in any way. Watch for thyroid storm, because during a thyroid surgery, your thyroid gland is being manipulated, which could stimulate release of excessive sudden release of thyroid hormones, thereby causing thyroid storm. Monitor also for signs and symptoms of hypocalcemia, which includes dysrhythmias, spasms, numbness, and most importantly, positive Chopsticks and positive Trousseau sign. Chopstick is nothing but when you tap on the face, you would see twitching of the facial muscle, and Trousseau sign is when you put a blood pressure cuff over your arms and then inflate it, you will notice that the hands take a flexed position like this, which is a positive Trousseau sign and a sign of hypocalcemia. Very, very, very important post-op thyroidectomy is to make sure that you're monitoring for signs of hypocalcemia.